Hello everyone, I'm Colin and welcome back to my channel. If you hadn't seen my last community tab post, I did decide to take a little bit of a break from posting, give my brain a little bit of a break after making a 3.5 hour lipedema video. But I will say, I don't know if I could consider it that much of a break because I have been working on things behind the scenes. One of the things I have been doing is I reached out to Dr. Tobias Bertsch, which if you watch that video, you'll know that he played a huge role in my research in uncovering what I believe is perhaps, in my opinion, allegedly a financial motive behind a lot of the popular conceptions about lipedema, especially here in the US. I actually did reach out to the organization that he is president of, the International Lipedema Association, or ILA. You'll probably hear him say ILA. I reached out to them actually, I think in June of 2024. Several months before I made my video. I never did receive a response to that email, which is fine. Honestly, why would you at that point? But I did happen to stumble across Dr. Bertsch's email while I was doing my research, and so on a whim, in like early December, I reached out to him and I was like, would you be available to do an interview? I linked to the video, but also was like, this video is extremely long. Totally fine if you don't watch it. But here it is, just for context. And to my surprise, he did watch it, and he responded very well to it, and shared it with some of the board members of the ILA. Boy, life sure is strange. I'm not sure how I got here, but I'm glad I'm here, but I don't know how I got here. But yeah, he was also generous with his time and agreed to do an interview with me, which you are about to see. I do want to disclaim a couple of things. First of all, obviously, I am not a medical expert. Dr. Bertsch is a medical expert, but this video is just for educational purposes. It is not medical advice. Secondly, obviously, I am going into this already heavily agreeing with everything he said, but I also, didn't want to make any assumptions, and there were also some questions that, I had seen in the comments and questions from people that I had spoken to that I didn't feel I could adequately answer, even though I did my research. And obviously, an actual expert in this field, the weight of his words are a lot more than mine. And also, I just thought it would be an incredible opportunity to pick the brain of somebody who I've really come to admire. Also, I have never done an interview in my life, so please forgive my nerves that were probably very apparent in this interview. But without further ado, please enjoy the video and stick around to the end. I'm going to give a few updates. You were kind enough to watch my 3.5 hour video. Was there anything that you thought should be corrected or clarified?
First of all, Colin, thank you very much for the opportunity to give this interview. I watched your video twice, despite the 3 hour length, but I didn't notice any mistakes. So to be honest, I was extremely impressed by your video. It's actually the best researched and most comprehensive work I have seen on this topic in many years, and I work for 20 years now in this field. So I have now distributed it to numerous colleagues around the world, including my colleagues from the ILA board. And they wrote to me, they were also very impressed by the thoroughness of your research. However, everyone was also shocked by the economic entanglements of this group and how dubious this pseudo-scientific approach is.
Well, thank you for saying that. I did want to mention that I had sent you these questions beforehand, and there was that one bit we discussed where I had I think a wrong list of references, and you were kind enough to also send me a correct list of references, so I will link that in the description of that video, just so everyone is clear on that. So thank you for that. Thank you for saying that. I'm
Welcome.
very flattered by that. So Dr. Karen Herbst and the Standard of Care Committee seem to be like the most prominent experts, at least in the US. And I just wanted to know if you had any general thoughts about them.
General thoughts about the standard of care, you mean, yeah?
Yeah,
Yeah.
yeah.
Yeah, okay. So first and foremost, I'm concerned about the statements in the so-called, we call it so-called standard of care, mainly because many of the treatments offered there will not help patients, and some even harbor the risk of harming patients. And there are 2 points particular that came out in your excellent research video. Firstly, there's a lack of scientific evidence for many of the recommendations. This mainly concerns the supplements the patients helped or should help by these products. However, and this is even more, it was touching me, is the second point. I find the Herbst group's assertion that severely obese patients primarily suffer from lipedema and need liposuction much more disturbing. I say to patients like these, patients with a BMI of 40, 50, or even more, if the diagnostic criteria for lipedema are correct, then I say to these patients, okay, you suffer from lipedema. That makes up 5% of your disease. But 95% of your disease is called obesity, and obesity is a disease and not a matter of fault. And we should first and foremost focus on your main disease, which is obesity. Or maybe in other words, focusing on lipedema in these severely obese patients is comparable to when a patient with, let's say, metastatic breast cancer comes to your clinic and you first treat her common cold. These patients are being misdirected, and I wonder whether the financial interests of doctors who earn a lot of money from liposuction are mixed with medical aspects.
Talking about some things that lack of scientific evidence, I thought that there were claims that Ehlers-Danlos syndrome, mast cell activation syndrome, things like that are like comorbidities with lipedema, and I wanted to know if you had any thoughts about that.
Yeah, this is a very important point. And I would also mention that there's a claim that it's connective tissue disease. So when I start with this, so what is connective tissue made of? So the cells of connective tissue include fibroblasts, macrophages, mast cells, and adipocytes, which are fat cells. So adipose tissue is part of connective tissue. But it is apparently more popular to say that lipedema is a connective tissue disease than to say there's too much fat in the legs. So this is mainly because obese people, and this is really a serious point, obese people are often stigmatized and discriminated against, not least by us doctors. Many doctors do not see obesity as a disease, but as a result of lack of willpower and indiscipline. And these doctors are also misguided and do a lot of damage, especially emotional damage to these patients. It's much more popular, I would even say, a populist for someone to come along and to say it's not a problem of fatty tissue, but of connective tissue. But of course, this is just eyewash. Not sure this is English, eyewash. Is it English? Or you say window dressing, maybe. Is it English? Yeah.
Yeah.
Okay, yeah. And regarding the first part of your question, the Ehlers-Danlos, hypermobility, and all the other comorbidities you mentioned, I could just as easily claim that lipedema is linked to heart disease or pimples on the face or liver disease. Yeah, This has nothing to do with the scientific approach. There's not a shred of scientific evidence for this. There's no reputable scientists who would confirm these claims. In addition, Colin, the often cited hypermobility, what you also mentioned in your video, Professor Ethel Furley, the founder of the Furley Clinic, which is the European Center of Lymphology, calls this a Karen-Herbst symptom with a wink. In no clinic in Germany, really, yeah, really. That's a joke during our ward rounds sometimes. In no clinic in Germany so far as I can see, nor in Europe, does hypermobility play a role when we talk about lipedema. It's, as I said, a Karen-Herbst symptom. And of course, her followers follow her here.
It's interesting, actually. I was when I was doing that research, just as a side note, I found out that I meet the criteria for hypermobility too. I feel like it's just very common, and I just wondered what you thought about that. Do you think those ideas are becoming more common?
I do not know. I think that the ideas, and particularly Mrs. Herbst, is very popular, especially in patient community and among colleagues who earn their money with liposuction. This theory, or maybe also Mrs. Herbst, is very present at some events in Europe, such as the patient event you show in your video from, it was, I think, from Italy, where you showed the patient conference. However, she does not play a role at relevant national or international scientific conferences, such as the International Lymphedema Framework, the ILF, or at national scientific conferences in Europe. I think the reason for her popularity, or for the popularity of this approach, becomes clear when you see your video. I think when you see these patient conferences you showed in your video, you will agree that more than 90% of the attendees, of the patients, are obese. The most are severely obese. And if somebody comes along and tell them that it's not obesity, but it's lipedema, that's much more popular. And I can understand that when I see that these people, they feel discriminated against it, what I already mentioned. So it's not really popular in the scientific circles, yeah, but it's very popular in the patient circles.
So would you say there's more of a medical understanding of lipedema versus like a patient understanding, maybe a popular patient understanding?
Yeah, I would agree. Yeah.
Dr. Herbst had talked about a new international consensus. I think that included the Alio Italia and a couple of other organizations. Were you aware of that? Uh,
No, I didn't know that. But I also think it's a good thing in principle. Medicine continues to develop. And if there is new, serious scientific data on this topic, it should also be incorporated into a new consensus. However, if you look at the so-called standard of care, it is clear that Mrs. Herbst only gathered her closest supporters around her. So my approach to the international consensus and later to the founding of the ILA, the International Lipedema Association, was completely different. I invited the undisputedly most important and renowned colleagues on this topic from different countries. So from England, Professor Christine Moffat, the chair of the ILF, Professor Christiana Gordon; from London, Denise Hardy, Nurse of the Year. In UK, both work for decades with these patient groups. From Sweden, Professor Hakan Bråsen, the worldwide most renowned surgeon in this field. From the United States, Günther Klose, who heads the world-renowned school on this topic. From Australia, Professor Neil Pillar, the doyen of the Australian lymphology, and so on. You can look at the list of the founding members. So I have not made my selection based on whether these colleagues represent my opinion. And if the new consensus takes a similarly objective approach, I would welcome that.
Well, it seemed to me that there were more patient organizations involved in that, which they would see as an advantage. I think it is an advantage, but maybe not the best way to go about making decisions, in my opinion.
I agree.
There was a series of articles that you had published, myths and facts about lipedema, and a lot of those were things that you will find in the standard of care as being truths. Um, and so Dr. Herbst and her standard of care committee um, wrote a letter to the editor, and your response to that was actually kind of the catalyst to me figuring out all of the financial incentive potentially. Did you ever receive another response after that?
No, we never received an answer.
Interesting. Could be a lot of reasons for that. So, one question that I saw a lot I've seen a lot in the comments of a lot of my videos where I've discussed this was how can you differentiate between lipedema and lipohypertrophy?
That was this was a question from your audience. Yeah.
Yeah, I saw it quite a bit. Yeah.
Okay, okay. So what does lipohypertrophy means? It means that there is disproportionate more fatty tissue in the legs than on the trunk. So is there any objective measure for this? In other words, at what point do we speak of a disproportionate or overproportionate fatty tissue? Who decides what is disproportionate or overproportionate? And isn't it in the eye of the beholder, which is the eye of the woman in question? And doesn't it perhaps also depend on the current beauty ideal? Currently, thin legs are considered beauty, at least in most part of the world. If you look at West Africa, I have colleagues here from West Africa. They told me they have a completely different beauty ideal. So big legs are there considered the ideal of beauty. So not finding your legs beautiful is, I hope you will agree, is not yet a disease. And lipedema only becomes a disease when the symptoms of pain are added to the disproportionate or overproportionate fatty tissue. Incidentally, this issue is now recognized worldwide, except among the Mrs. Herbst followers. The German guidelines, which were published last year, we have also an English version, which was published in August last year, explicitly state that both symptoms must be present in order to make a diagnosis of lipedema. So disproportionate fatty tissue in the legs plus pain makes the diagnosis. I'm not a cosmetic doctor. I'm an internal medicine doctor. I treat symptoms. So if I can reduce my patient's pain and treat the obesity that many patients have at the same time, I feel I'm on the right track.
Yeah, there's one thing I noticed that a lot of people like on the standard of care committee would say, well, it doesn't have to present with pain. And in which case, my question would be, what else is there? I assume they would say the only other symptom present would be progression. And would you agree that, I mean, what would you say to that?
So there's also another statement from the new German guidelines that we know that lipedema is not a progressive disease. You can read it also in the German guideline. But of course, when you gain weight, then the obesity is progressive. And then when you gain 20 kilogram or 10 kilogram, or you have pounds, I think when you gain, let's say 30 pounds weight, yeah, of course your legs are getting bigger. That's a typically for women, where men gain weight over proportionally in the area of the belly, the tummy, yeah, and women gain over proportionally weight in the lower part of the body. So what is progressive is not lipedema, but obesity. So what we see in our patients in the clinic, and this is a good message for our patients, when the weight is stable, lipedema is also stable. It's not possible that you gain weight, that lipedema is getting worse, that your legs are getting bigger without gaining weight. Yeah.
So there are some people who have said that lipedema fat feels or looks or behaves differently than typical fat. Um, would you agree or disagree with that?
Now, fat cells only, it's just what I said, fat cells only ever develop as a result of an imbalance between too much intake, which is eating and drinking, and output, which is movement, exercise. So to claim that lipedema can form fat cells on its own, I read that sometimes also from this group, contradicts the first law of thermodynamics. You also mentioned that in your video. This is a physical law, and even Mrs. Herbst cannot override this. So let me refer, there's an article from the Harvard group. Give me 1 second. I love this quote because a quote from this Harvard article. The first law of thermodynamic stipulates the change in internal energy of a system, such as an organism, must equal the sum of the energy inputs minus the outputs, and obesity results from a net positive energy balance and not from the differentiation of new fat cells, end of quote. So put it more simply, I love this quote, put it more simply, the calories in stored triglycerides must come from somewhere. The body cannot create fat cells simply by converting one cell type to another. So claims that adipogenesis and lipedema is the cause of obesity, therefore violates the laws of thermodynamic and must be rejected. So fat tissue is fat tissue. There's no difference between fat tissue in pattern with lipedema and without this diagnosis. And personally, I examine 2,000 patients a year who come to me with this diagnosis. And by the way, very often these are misdiagnoses. And I feel no difference, nor do I see difference when I perform high-resolution ultrasonography on these patients. And you can't see any difference in MRI. However, recent studies indicates that we see a slight, very harmless, but a slight inflammatory reaction to the fatty tissue of women with painful fatty tissue, which is lipedema. In particular, we see an increase in macrophages. And macrophages, that we know from different studies, play a role in the perception of pain. Though in this respect, histologically, is it English? Histologically, the fatty tissue seems to be altered in patients with lipedema. We do not yet know why this is the case. That is why some women with disproportionate fatty tissue experience pain while others do not. This is still an open question.
Well, thank you for that. Very useful to know. I feel like I kind of left off my video feeling very hopeless. But I think this is a great opportunity to ask, and I will disclaim, and I'll go ahead and disclaim again, it's not medical advice, but are there any red flags that you think patients should look for from a clinician?
Maybe I respond first to your comment. What was also your last comment in your video regarding the hopeless. You ask yourself, what is the worth of this video? And I would say your video is so helpful if only one patient see your video and decide against liposuction and perform bariatric surgery when she is severely obese. Your video was worth to do. All your work was made sense, and you can be very proud on this. So this is my first comment. And generally speaking, regarding the, what do you call it, red flags, or what I can say, patients. Generally speaking, if your patient get the impression that your doctor is primarily trying to make money from you personally, leave the practice as quickly as possible. You should then look for someone whose main concern is to help you get better. And in concrete term, if your doctor tells you that your lipedema is a lymphatic disease or an edema disorder, leave the practice immediately. If you also suffer from obesity in addition to your lipedema, but your doctor ignores obesity, leave the practice immediately. If your doctor recommends liposuction, even though your BMI is 35, 45, or even more, leave the practice immediately. And if your doctor recommends liposuction without having tried conservative therapy with you, which is compression, movement therapy, psychosocial therapy, and weight management, leave the practice immediately.
That is all of the questions I had. I did want to leave the floor open if you had anything else that you wanted to say, since I don't know, I think this is a great opportunity. So anything you wanted to say at all?
I thank you very much for your video. I think you helped a lot of patients with your video, and I spread that already, and I know that other colleagues spread it worldwide. So I hope you will get a few more views or clicks, if you say clicks, more. And yeah, thank you.
Thank you. I mean, obviously, I do want to thank you for first of all doing this, but also I would not have been able to make that video if not for all of your work. So thank you so much for that. And I appreciate you spreading the video and whatnot. So
I think it's a win-win situation. I think that hopefully you will gain more popularity in your field because people respect your competence in this field, and the health professionals will have a win, and all the patients who see this, they will also have a benefit. So it's really a win-win-win situation. Thank you very much.
I appreciate that. All
Bye,
right.
Colin.
Bye. Thank you so much. Once again, I really want to thank Dr. Bertsch for doing this interview with me. I really enjoyed it. I hope everyone else watching this will really enjoy it. It's coming at a very appropriate time, I feel, because I just saw the other day that Glitter and Lasers, who is my introduction to all of this, is starting a podcast in which she is going to talk about medical mysteries, I believe, starting with her own.
So about 6 months ago, I was introduced to Dr. Erin Nance.
She's this super badass orthopedic surgeon in New York who raises awareness for diseases that disproportionately affect women.
Out of that introduction came something I'm super excited to tell you about, the Medical Detectives podcast. Each week we're going to be diving into a story from someone just like you who has faced a challenging or difficult or sometimes even mind-boggling medical mystery. First episode of Medical Detectives, well, it's really special to me because it's actually my story. And it's parts of my story I've never shared before. I hope you'll join me and listen in on Wednesday, January 8th for our launch episode.
In my brain, I've kind of been like, I'm only going to talk about Anna again if she starts spreading more misinformation. And, well, let's just say I will be staying tuned for that.
If you've ever been told by a doctor that you're too fat and being fat is a risk factor for having a complication with potential surgery, this video is for you. Like, we have been focused on the wrong thing this whole friggin' time. I'm sure there's a bunch of nutritionists on this app who can give me actually more relevant and recent information, but would love to spread the word and the education about the importance of nutrients rather than your weight in helping recover from surgery.
One other thing I wanted to update you all on was if you watched my video, my lipedema video, I briefly mentioned for like 2 seconds, there was an organization called Cover Lipedema, which was a patient-run organization that tried to help patients get liposuction covered by their insurance, and for a fee of like $1,400. And it turns out that organization has shut down as of, I think, December 31st, 2024. Coincidence? Probably. I don't know. I just thought that was an interesting coincidence. I think a lot of people are probably disappointed by that. In my view, knowing what I know now, I can't not see that as kind of a positive. Very clearly, especially in the US right now, there's a lot of talk about insurance and just the heinous nature of the insurance system here in the US, and as heinous as I think the American healthcare system is, the insurance system especially, I can't help but feel a little bit relieved that that kind of organization has closed its operation, just because it feels exploitative, you know? The insurance system is exploitative, but that organization felt to me a little bit exploitative as well. Last thing I want to update you all on is, yes, I have been on a break, but I have been writing. I've been working on my next video. Very similar concept where I was trying to do one thing and it exploded into something else. So I'm not sure when I'm going to be done with that. So you might see me then, or I might come back sooner than that to talk about Anna's podcast. So stay tuned. We'll see what happens. Thank you all so much for stopping by. Don't forget to like, comment, and subscribe. Thank you once again to Dr. Bertsch for doing this interview. I hope you all enjoyed it, and I will see you next time.